Yeah, I'm graduating this month with my Bachelor's of Science in Nursing from Cal. And how I got into nursing was in high school, I was able to shadow a few nurses through my high school medical program, which I really liked, like the day-to-day work of it. But what really got me inspired was some of my family. We just run a hospital for different things. And I felt like the nurses in the hospital really stood beside my family and they turned what could have been something really scary and traumatic into a very positive experience. And just after these experiences with these nurses, I realized that nurses, they have the ability to really care for and really change the experience of a family, and they have such a great impact on care. And I realized that I needed the kind of nurse that these nurses were for my family. Alongside of doing all this stuff, I was also tutoring and nannying, babysitting, working with kids in different capacities. And then going into college, I was lucky enough to work in a nursery at a local daycare. And this experience made me realize I really love working in a team with other team members. And I also just love working with babies, and I want to work in pediatrics in some capacity. And then finally, I was able to do my capstone here in the NICU, and this was just an amazing experience. It really ignited my passion for NICU nursing and wanting to serve the pediatric population. And the nurses on the floor really inspired me with their care and skill, causing me to want to apply here. First of all, it's the number one hospital in California for pediatrics. And honestly, I've had friends come here and receive treatment for heart issues, cancers, had surgeries here. So I always grew up knowing that it's like the place to get good care. But on a more personal note, I really align with this mission of creating hope and building healthier futures for children. I where did my train of thought? I'm so sorry. I don't know why I just like bleeped out. But yeah, and just on my sorry, I will not do that during the interview. Yeah, and just during my preceptorship, working with the nurses up close and personal, like I said, I just really got to see how much they really cared about all the kids on the unit and how deeply skilled they were, but also just how much they really cared and took their job seriously. I felt like every single nurse really wanted to give the best to their patient. They didn't just see it as like a task to check off or like, oh, I have to go do X, Y, and Z or take care of this kid. They truly deeply wanted to learn about the kid, connect with the family, learn more about whatever disease process the baby has gone through, and really just want to do right by that child. And I admired that because that's something, as a new grad, I want to pick up from the nurses around me. And I want to be an environment that really pushes me to be the best possible nurse and just do the most for my patient instead of seeing it as just like a to-do list. But yeah, all those factors really influenced me to apply as a new grad program here.
I love that. What if they ask, why do you want to work with in the NICU specifically?
Yeah, well, I feel like I said, I've worked with the pediatric population in like so many settings and with so many kids and different abilities and age groups that I just knew I wanted to work with kids in some capacity. And then during nursing school, my third semester, we had a peds rotation, and my first day was in the NICU. And I wish I could just give it actual like words or point to something specific, but honestly, I really just clicked with it. I was just so enthused and passionate about just helping the sickest, smallest little beings and helping them be able to go home and be with their families and really get them back on track. And then my preceptorship, I feel like I got a better and wider scope of what being a NICU nurse really is. And I just really loved that usually you can build a bit of a relationship with the families here. The kids are here more long term. You get to really get in depth with the diagnosis and really get to learn something new every day. You get to just enjoy that patient longer, which is something I really admire. And I feel that you are a really big part in their care, and you become a really big part in that kid's childhood, whether they remember it or not. And you're doing something really important for that family, and you can really make that situation, you can make that family stay in the NICU something positive and something that they're thankful for and isn't not traumatizing, as opposed to something that's scary and something that that family feels very alone in. And I feel that I would just be able to make the biggest impact as a nurse in the NICU.
If you find these videos helpful and you want to grab your own list of nursing interview questions, over the years I've collected every question that any new grad has told me they've been asked in their new grad nursing interview, and I've compiled it into a 22-page, 72 question PDF that you can download. It's $5, but with your discount code, you can get it for $3. So your discount code will be just YouTube. So I'll put the link in the description below. Go ahead and check that out if that's something that you think would be helpful. The idea is hopefully you'll encounter any questions that they're likely to ask you to help minimize any surprises during your actual interview. They might ask, tell me about a time that you made a mistake and how you handled it. So basically the points for this are about a mistake that wasn't super critical, something kind of minor. Don't talk about like a med error or anything like that. And then you have to make it like a big deal in your head. You have to say like, it was really alarming to me because I realized it could have been so much worse. Let's say the situation had involved a medication or something like that, that, I really need to, going forward, I need to do this thing and do this thing. And so I always do this. And it has really helped me improve. And I'm so grateful that this was brought to my attention. And that nurses are allowed to openly share their mistakes. I love when my preceptors talk to me about past mistakes that they've made, because it really helps us put the patient first and that kind of thing.
Okay. Yeah. So this one time in my emergency, I was getting a new admit and I was trying to help take all the vitals and make that patient comfortable. And I just got blood pressure, heart rate, and pulse done with the vitals. And I was about to take the patient's temperature, and the patient asked me, "Oh, I need a pillow. Can you please get me one? I'm so uncomfortable." And I immediately put down the thermometer and was like, "Yes, let me run and get that." So there was other people in the room, but my clinical instructor in the room, and I left the room immediately. I searched this whole unit for a pillow, and the thing about this unit is that it's not the most stocked unit on the planet. So I searched for 5 minutes. I couldn't even end up with a pillow, which is one of the worst parts. I came back without the pillow, and I apologized to him. I was like, "I'm so sorry. I'll find you one in 10 minutes. Our supply room's currently empty, but we'll get you one soon." And I took the patient's temperature. I got him situated. He was stable. And I had to go leave to do another task. But as I was about to leave, my clinical instructor, who was watching all this went down, flagged me over, and she just was like, "What did you do wrong?" And I was like, "Oh, well," and I kind of went through a laundry list of like, "Oh, should I have put on gloves at this point? Should I wash my hands?" And then she's like, "Nope, nope." And then finally I was like, "Should I have taken the patient's temperature before?" She's like, "Yes, you should have taken the temperature before you ran and got the pillow." And she just explained to me that vitals are really just important, especially when the patient first comes in. One, to have a baseline, which I knew, but two, that patient could have been running like 104 fever, and I could have been running around wasting time trying to find a pillow to make them comfortable, which is nice, but it's definitely not the priority thing to do in that situation. And I should have told him, "I will find you a pillow in a minute. Please let me just take your temperature." That situation really made me realize how important your initial assessment is. And especially in a critical care situation, I could have been getting anything. So as nice as it was that I ran around trying to find that pillow and I wanted to make him super comfortable, and it was a situation where I was allowed to make that mistake because the patient was stable in the minute, and my instructor could see that and wanted me to make the mistake, so I remember. It's good to know, because in that future, I might not have the patient who's stable in that moment, and I should always make sure to just do my assessment first before doing any extra stuff for the patient.
I love that. Maybe because sometimes they'll say to you, like, "I'm not just something to check off your to-do list. Like, you can't just come in here gangbusters and I don't care about your to-do list," kind of thing. So instead of like, "Let me just take this temperature," you could say, "Let me just make sure you don't have a temperature." So it's sort of like something you're doing for them to keep them safe, rather than something you need to get done before you do other stuff, kind of thing. And then maybe it comes out better because it's something you're doing for them just to make sure they're okay, kind of thing.
Yeah, that's right.
And you can use this for a time that you got constructive feedback.
Yeah, that was going to be my same story.
Yeah. They often ask about a time that you went above and beyond, or a time you provided compassionate care. This is the super sweet story where it leaves an image seared in their mind of where they're like, "Oh my God, we need this girl. Our patients need this girl."
Yeah, so in the ICU, I had one patient with my nurse, and when I was doing cares for her, I kind of noticed that, so she was on a ventilator, but I noticed that her hair was like really matted and just kind of in like a little tight bun in the back. And for those cares, we were able to move her to the left side, and I had a little bit of time after. So I went to the supply room and I grabbed a comb and some conditioner. And I know if you like water down the conditioner, you can kind of make a very weak detangler. And I kind of just spent some time with her, detangling her hair a little bit. And then I was able to braid it and kind of just leave it looking a little bit nicer and not as matted. And I went back to sit with my nurse and chart for a little bit. And then when that patient's daughter came in, she noticed that her mom's hair was done, and she just like teared up a little bit, and like she just expressed her appreciation to us because she felt like her mom was really being cared for in a very like whole manner, and she really just was thankful to see her mother in better shape. And it made me realize that even just the little things that aren't super nursing related or that are ordered make a really big difference, especially the family, and there's something that we'd want done for us or a family member in the hospital. And it made me just realize that, if you have the extra time, going that extra mile can mean a lot to the patient and the family member.
Oh, I love this. I hope they ask you this. Another thing you can because family members, sometimes they're scared to leave because they're scared, like they need to be there, right? What if you could give the impression that she had said something to you about how seeing that someone takes such care in little details of how to make her mom not only safe but comfortable and well taken care of, it makes her feel like her mom's in really good hands, and she has to go to work or something, that she knows you guys are taking really good care of her.
Okay. Yeah, she was kind of saying that to my nurse and I, so I feel like I could kind of just, she was kind of saying that essentially. So yeah, I could definitely try to make a point to say that the daughter felt, that
I
her
was
mom
actually
was being
watching
cared
this
for.
thing on Instagram this week, and the question was like, it was just this like viral little reel. It was like, what's something that you see people do as nurses and you're like, damn, it's a good nurse. And this girl was saying it's when people take the time to like do their patient's hair. That's the thing where she was like, respect.
Yeah, no, I mean, it's definitely something. I feel bad saying that story because I know in the future it's not totally realistic that I'd have the time to do like every patient's
No,
hair.
I did.
Well,
I
I
did
mean,
my
that's not what
patient's
they're
hair this
asking for.
week. No, you're supposed
Oh,
to.
that's so sweet.
Yeah.
I'm glad. Yeah, I'm glad you did that. That's so sweet of you.
I was
But
inspired
yeah,
by
no,
it.
I
I
think
was
it
like,
is
I
fun.
want to be the one she's talking about in the
That
video.
nurse. Yeah.
Yeah.
No, I always feel like for the patient, especially when they're on the ventilator, they're probably already uncomfortable and it's like a weird thing. And then the least I could do is
Yeah.
like make sure that their hair isn't. Oh, I'd be so upset if like I take all this care of my hair and then it's like all knotted up and nasty leaving the hospital. I'd be so sad.
Right.
So I don't know. It's
Well,
like
the
the
other
least
thing
you could
is
do, I
too,
guess.
like
Give it in.
even, when people die, right? There's someone whose job it is to like make them look nice
Make it
for
more
people
pretty.
who are viewing them or
Yeah.
whatever. Yeah.
That's a good way of looking at it. That's true. Yeah, it's like
Yeah.
it's like a decency kind of for that patient.
Yeah.
But
Yeah.
yeah, so a difficult patient I had was actually, I just remembered, I had a thing and he was so scared to be there. I felt so bad for him. Every time someone, a nurse, any kind of staff member in scrubs got near him, he would just cry and he just really don't want to be there. And my nurse asked me to go give him about like 12 milliliters of, I think it was like cough syrup or some kind of syrup. So I come in, I don't even, you can't even see the syrup. I'm just coming and try to say hi and like kind of build a little bit of rapport with him. And he immediately is like, sees the scrubs, is not having it, which is totally okay. So I kind of just explained to the parents like what the medicine is and tell them that he has to take it. And I asked like, oh, I can step out, kind of watch you guys if you guys want to give him the medicine. I would still be watching. I was just like kind of, I wouldn't be staying there right in front of him. And they tried and it really just wasn't working. So they gave me the medicine back to me. And I asked, can he have JUICE? I don't want to say the word out loud in case he couldn't, and then it turns into a thing. And the parents like, yeah, he likes that. And so I went and got some juices, and I also got a Band-Aid, and I took it off, and then I drew in pen a puppy on it, and I drew like other little like smiley face, cute little Band-Aids because we didn't really have any stickers on the unit or anything for like kids specifically. And I came back and I like kind of just talked to him slowly and I didn't show him the medicine yet. And I just was like slowly like trying to like, I just kind of gain a little bit of trust and show him that I wasn't gonna like force him to do anything or do anything to him without his permission. And he kind of calmed down a little bit. And I kind of was like, oh, look, like if you take this medicine, you can wash it down with a juice. Do you like apple or grape? And he was a little bit more on board. He wanted the grape juice. and he still didn't really want to do it. And then I was like, oh my goodness, like look at these cool hospital stickers. They're just like little band-aids, little doodles on them. I'm like, look, if you take your medicine and drink the juice, you get to like put this on and everyone knows you were so brave and you did such a good job and you get to go home. So he agreed. He was like, okay, but I do it. And I was like, okay. And the medicine came in one of those little syringes, the oral syringes. So I took out a saline flush and I made him practice just slowly pushing the flush into a cup. And then finally I was like, okay, you have to put it in your mouth. And he slowly took the medicine and then washed it down with the juice, and then was really happy to get the Band-Aid. And then luckily the family was able to be discharged. But even though that took a little bit of time, I felt that I was glad that I was able to just slowly get that child to warm up to me and be able to take the medicine rather than like just have like a parent hold them down and like do it, because I really value, just that patient's experience, and I want that patient to leave feeling better and not, I don't want to traumatize the kid, because I think if you can just go the easy route and like force the kid to take it and like not be as thoughtful about it, but I think it would make things hard in the future. And I was just thankful that I was able to get that child to comply, but without it being something like super traumatic for him. I had a dad, I was walking down the hallway and this dad kind of pulled me aside into the room and was like very upset with the amount of time that him and his world had been waiting for care. He was just really upset. So I just started by, I acknowledged that even though he was upset, I didn't feel like that situation, I didn't feel like he was dangerous or a threat. So I didn't feel the need to escalate it to the charge nurse or anything like that. So I just let the dad explain in his words just what was going on and like why he was upset. And I just took the time to be thoughtful and really listen to what the dad said. And he explained that he was upset that they've been waiting so long, and that the nurse came by once and gave the kid Tylenol, and he's upset because Tylenol can be bought over the counter and they could have done that at home, and the trip was kind of a waste of time for them. So I let him express his feelings, and then I just acknowledged that it must have been really stressful and that I'm so sorry that he's been waiting so long. We definitely have not forgot about him. And I asked, can I reassess your child? And the dad was okay with that. So I reassessed, I took all vitals, and I reassessed the child's pain, and the child was still stable, luckily. And the child ranked his pain at a 4. So I just asked if it was okay if I just re-escalated that to my nurse and see if the nurse could come in and give the baby or the child something else. And the dad really liked that answer. So I got the nurse to come in and give him another dose of Tylenol, and just tell the family or tell the dad that we were going to recheck in with the doctor and just see where he's at and make sure that, he's going to come around soon. And after that, the dad it de-escalated the situation. And I think the dad just felt better knowing that we didn't forget about him and that we were listening to him and his child and we did care. And I felt like the situation was able to be de-escalated in a safe way, and that we were able to just show that we did still care, even though it was a super busy and crazy night on the unit. So the time I provided family-centered care was we had a little girl coming in for a lobectomy. And the family was just going through treatment with that. And we admitted her. And I think the family was having a really, really hard time. So whenever I had extra time, I just popped in to really talk to the family, because I felt like they just wanted someone to talk to and express their feelings to. And I really just made sure to just ask them how are they doing, asking if there's anything I could do to make them more comfortable. And I just wanted to ask about their experience, because they wanted to kind of just tell me about, just their journey up until this point. So yeah, I just gave them an opportunity to express their feelings, express like the highs and the lows with having a child with this disease, maybe just the issues that they've encountered along the way, and like their wins and losses. And I think I spent a total of like an hour and a half in there, like doing cares and just listening to them and talking to them. But at the end of the day, the family just expressed how thankful they were to me and how like cathartic it was just to like talk about the situation with somebody who kind of like understands. Like, obviously I don't have a child, and I don't have a child, so I can never like truly completely know how they feel, but just, someone in medicine who understands like, how hard it is to have a child, like, how hard it can be for children to be sick, and, how difficult the toll it takes on the family. So I think just having someone there who they knew they could turn to and it was in their corner, would advocate for them and listen to them, really made a big difference in their stay. And they said that it made the scariness of the lobectomy a lot less scary. So it was something small that I was able to do, but it really made a big difference to them, and it really showed me that just doing something small like that really does change your patient's experience and, helps them know that you are walking alongside of them and that they don't have to go through this whole situation alone and that, their child is in good hands.
What about the one about the constructive feedback, where it's kind of like they gave you this advice that made you so much more successful at this like task that was previously hard for you? Report? I feel like a lot of people talk about report.
Oh, giving report. I've definitely been given feedback on that. I definitely don't have the strongest report.
So basically talk about how you've struggled with giving report, talk about some like someone was like, can I give you some feedback about this? Tell you some things that really helped me. And you were super grateful for that. And this is the feedback that they gave you. So you actually practice with that person and your preceptor before you would give your real report. And it made your flow of your report so much better. You got a lot of great feedback from the oncoming shift. And you felt so much more confident in your report style, which really helped you kind of, I don't know. I lost it, but
No, that was good. That was good. I'm trying to think. I've definitely had similar things, or like with S bars where I'm given an S bar like as practice, and my nurse was like, we're gonna, try it this way.
I feel like the report thing is something everyone's been through. So
that's why I'm trying to think of something else.
But for me, they told me I was like jumping all over the place, that I need to go name, code status, age, allergies, diagnosis, history, plan, and then go systems. Go like lines, IVs, whatever. So order.
Honestly, my report is still not strong. So then you're like, it was improved from that. No. When I would initially give a report during my OB rotation, I would just say everything about the patient completely. Like during assessment, I would tell you all the vitals. The vitals are normal, and I would tell you all the vitals, and I would tell you every little thing and how they felt, and on and on and on. And my professor was like, that is not an efficient way to give report. It's not going to help anybody. You need to just say the relevant things and, say the abnormal things, and not just, if you just go on and on and on, it's not going to, it doesn't matter if the heart rate's like 100, great, like that's what it's supposed to be. So she had me practice it again with just the, what is abnormal, like actual assessment findings. And that made a huge difference because from then on, I give report every shift, every clinical. So I was just able to really use that format and use that feedback to improve something that I'm going to be doing for my whole career. And I was just really thankful for that feedback. And it just made me a better nurse.
Okay, cool. Yeah, I like that. Okay. Like clean, cool.
In sim lab once, me and a partner had to work together to do an assessment and then S-bar to a doctor over the phone. And we went in and we both decided that we were going to do the assessment together because we had to do a really big amount of full body assessment in just a really short amount of time. And it wouldn't be, productive for one person to just sit there. But we didn't clarify super like roles or way too much beforehand. And we're doing the assessment and we're both kind of like getting each other's way. One of them would have she would have a piece of equipment I would need. We're both working on, counting respirations, but no one has put on the blood pressure cuff. It was kind of like a little bit of a mess. And then the doctor called to give a report. We didn't clarify who was gonna, pick up the phone. So we're very ill prepared. And I ended up picking up the phone, and the doctor is asking me for assessment details, and I'm returning to each other like, oh, you got that one. And then we realized no one did, that part of the assessment. And it was just like a very disorganized, and we didn't end up really completing the objectives of the simulation, it just felt a little disappointing. So walking out of the sim, I just asked how she felt about it. And she explained that she just didn't feel too great. Like she felt like she knew more than what she showed. And I agreed. I said that I felt the same way. I felt like it just didn't flow very well, and that I felt like we could have done a more efficient job. And so together we talked, and we just decided to specifically split up parts of the assessment. And she would do all the assessment she would do all the things with the assessment that involved equipment, because she liked to practice putting on the EKG and the blood pressure cuff. And then I would do all the neurological assessment and talking to the patient, and then counting respirations and pulses, and on and on and on. And we also decided that she felt that it was she felt like it would be better for me to talk to the doctor and she would be with the patient so we didn't leave the patient alone. And then also I could yell at her in case we did miss another thing. She would quickly try to get that assessment finding so we could still give it to the doctor. And we ran the sims twice at my school. So we ran the sim again with all those corrections. And the second time around, we got to finish the simulation with extra time to spare. And we covered all the assessment details in our first assessment. And we walked out and she's like, yep, I feel so much better about that. Like, I felt like I really got to show what I knew. And I definitely felt the same way now that we completed the assessment and it was like organized. And I felt like we both just walked out of there feeling both better about our performances and able to really show the professors what we knew.
Yeah, you can even talk about how going forward you could see that being a really good learning experience in terms of clarifying roles for sort of more of a emergent situation. So being really clear in a code of, which tasks you're taking on. While it was just a sim lab, it was really helpful to see what a difference it makes to know who is responsible for what role.
Yeah. I think last time I followed up with saying like it made me realize like how important communication is, which is like kind of simple, but also like knowing that you can also maybe give feedback that like you didn't like, you didn't love your own performance in something, or maybe like what you guys did together wasn't like the most efficient, and you can give that feedback without it being like hurtful or attack. It could be like just a way of problem solving and getting better, improving, rather than like it wasn't going to cause issues or wasn't going to be like something taken in offense. It was purely like I want to improve type thing.
No blaming or
no blaming.
That helps because it's the question is about conflict, and so like how you communicate in a conflict, I think, is a good way to like round it out.
Yeah.
I
had like a nurse and she was like being really mean to a PA and like was like, I don't like this PA and all this stuff. And then was like just telling me, it was like the first night with her and she was just talking about she doesn't like the PA and the PA is annoying and da 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 da. And then later I was kind of like, oh, I think she's just trying to help. Like, I think she's just trying to like, build a friendship with you. And like, I don't think, that PA means any harm or anything. And then the nurse, she was like, yeah, you're probably right. Like, I should probably I could be nicer. Like, I'm just tired and it's just been hard and I don't want like any more issues like that. So she kind of admitted, and I feel like she kind of softened up on the PA. She never like outright apologized to PA or anything, but she kind of was like, yeah, like that's a point, and like I could see that. And then I did feel like she, was a bit kinder to that PA. I don't know if that sounds like I was winning. I didn't want. You like that one?
Because it's basically assessing your ability to, like, when you're faced with a situation where it's like either you kind of blow up your place in the hierarchy or like stay silent, but then the patient takes the fall or somebody else takes the fall because you were too chicken to speak up against someone higher up. It's like assessing your ability to like advocate for that person in a way that isn't like social suicide with your preceptor or your manager or whatever, So you could say that when I was there was a nurse who's really great in teaching me, but she was speaking loudly enough for people to hear very badly about a PA.
Yeah, and she was she was telling other nurses too. She was like, I don't like so and so, and da 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 da. She's annoying, and she doesn't know anything, and XYZ.
So don't mock her voice, but you can say, was talking with other nurses at the nursing station in a way where, other nurses, maybe patients, even me as a nursing student could hear, and things that were damaging to the PA's like credibility as a provider, saying, that they're annoying, that they don't know what they're doing. Things that if she really wanted to help the PA, that's not the way to do it. These things were just kind of meant to be hurtful and damaging. When I felt like it was a good time and place to do so, the next time she brought it up, and then say, but what you said was perfect, maybe this, maybe that. And she was like, yeah, okay, fine. And then highlight kind of like the difference, the contrast of like, after that she watched her be nicer to the PA and not publicly say, harmful things about the PA.
Like damaging. Yeah.
Yeah. And
Okay.
then maybe just talk about how it was a good learning experience of how to, um, when someone who is more experienced than you is being disrespectful to another provider or to a patient, how to, advocate for the person who is being talked poorly about,
Mhm.
while still respecting, how much knowledge that person has, whether it's a doctor, or just to make sure that everyone is being treated with respect.
Okay. Yeah. Okay. I like that. Do you want me to like restate
Yeah.
this? Yeah. Okay. Perfect. Yeah. So one time in there, I had a nurse and she was wonderful. I've been following her most of the night and extremely knowledgeable. Um, but at one point, I noticed like really loudly she was talking very poorly about one of the PAs to like the other nurses, and it was where like a lot of other staff members could hear, and a lot of I think patients walking by could hear, and she was talking about kind of damaging that PA's credibility as a care provider and just as a person. And I didn't want to disrespect my nurse, but I just felt like, what she was saying was really hurtful about the PA, and it wasn't, you know, um, helping the PA get better in any way, and it wasn't anything that was, contributing to a positive or healthy workplace. So, whenever it was just me and my nurse at one point, I kind of just, my nurse was telling me about how much she didn't like that PA. I kind of just offered that, I think that the PA was just trying to kind of make friends with my nurse, and that I felt like the PA was well intentioned, and that, I don't think the PA was like, I kind of suggested another point of view with the PA, and that she was really working hard and trying, her best. And she was also new to the team. And I think saying this, my nurse kind of softened up a little bit. And she was like, yeah, you have a point. Like, I don't think that PA means bad. I think I'm just like really tired and I've been here for a while. And it's, tough to have a new person come on and think that they know more. And she kind of just explained her point of view, but she did acknowledge that she could possibly what she was saying was a bit hurtful, and that there was like a nicer way she could have gone about the situation, and she could have talked to the PA herself. And after that, I saw that my nurse was definitely a lot kinder. She didn't speak poorly about that PA at all. She was definitely kinder in her interactions with that PA, and I felt like she had maybe just like a different point of view or a bit more understanding with that PA. And even though that situation was a little bit scary for me, because that nurse, she's very experienced, very intelligent. And I did look up to her. She was 2 years older than me. And I felt like we had like a bond, and I didn't want to break that bond. I felt like it was like important to just point out that like, words do hurt, and that, there's definitely like a healthier way that that situation could have gone. And I think just like reminding her and giving and just pointing out like a different perspective to my nurse allowed my nurse to just take a step back and kind of realize like, her words have an impact, and that there's definitely like a professional way she could go about her thoughts and feelings. And I think it just created better understanding for both sides and was overall a positive experience.
I like that, like her words have an impact. That's my favorite part.
Thank you. I appreciate it. Thank you. Thank
No, I
you.
think that's good. Okay, cool.
We kind of talked about this one. And we landed on was I noticed a client at a skilled nursing facility, and he wasn't really eating or enjoying his food. And I noticed that he had a lunchbox that his family brought on their visit. And I just came in and talked to him, and I just asked him if he was enjoying his meal, and he explained that he didn't really like it. It wasn't really what he preferred to eat, and he said that his family brought food, but he didn't want to trouble anyone to heat it up and like do anything about that. So I just was like, oh, let me heat it up. It will take, 5 minutes. So I grabbed everything and heated it up, and then I brought it back to him, and he just told me that he started explaining like that he missed country like food from his home country, and that he just like if he felt like that food helped him heal better than like maybe the food that was serving at the facility. So I just sat with him for a while, and he kind of just talked about his childhood, growing up in the Philippines, the food he ate, and then the food that he taught his kids how to make, and how that his kids brought that food in. And he just shared with me how special it was to him, and that he really looks forward to going home and like having those dishes with his family. And I just was really touched with how much he wanted to share with me, and how important, food was to him, and how, it really did make an impact on his day, being able to eat what his family brought him rather than, being forced to eat at the facility. And that just, again, it's just those really small things you do as a nurse that aren't even on, that aren't in order, or, the patients might be too scared to ask you, but it's just those small things that make a really big difference to them and their healing. And yeah, just, I always try to keep my eye out for a way to, make my care more tailored to people's experience and culture.
Okay, cool. I like it.
Oh, okay. So in 1 year, I do see myself working on the floor in the NICU. I hope to just grow in skills and confidence and just my knowledge in caring for the NICU population. And in 5 years, I see myself here, hopefully maybe orienting a staff member or precepting for a student, and maybe even being a charge nurse, fingers crossed. But yeah, I really do see myself staying in bedside nursing here. And long term, I want to be a NICU nurse. This is just what I feel called to do.
Yeah, for self-care, I really make sure that I leave work at work and my home life at home, and I keep them very separate. So when I'm home, that's my own time. And I make sure that I keep active in the community. I hang out with my friends a lot. I like to read in my free time, go to yoga classes, and really just slow down and make sure that I take care of my physical and mental health. And yeah, I'd say that was my hobbies and self-care. I was going to ask, because I saw it on your list of questions, and I was going to ask, like, is there something they're trying to learn through? Like, is this a strategic question where they're trying to figure out, like, X, Y, Z, or is it just, like, a fun, like, do they actually kind of do, like, oh, okay.
Like, because you know how sometimes they're like, tell me about something about you that's not on your resume, like that kind of thing of like, tell me something about you that has nothing to do with your career.
Okay. Something that has to do with me. Like, I don't have anything like that cool. I shouldn't say that. I wouldn't say that to them. I take a lot of sewing classes, and I sew a lot, and I do a lot of thrifting, and then I I sell it on Depop. I used to be like a big Depop, and I would like sell. I do a lot of resale for clothes and stuff. So I'll just like thrift lift it. Yeah. So I'll like, if I get a dress and I'm like, oh, this would be a lot cuter if I like brought it in and added this and like cut this off, I'll do that, and then I'll flip it and I'll sell it. But half the time, have my friends buy it off me instead because they want it. So yeah, I kind of like part-time thrift flip. It's fun. If nursing completely some reason didn't work out, maybe that's what I would be doing full time.
That's so cool. Say that. So that's the hobbies part, and then the self-care part is you kind of have to give a slight nod to that you understand that while the NICU is amazing and you have a lot of great outcomes, you don't always have great outcomes for patients, and sometimes the plan of care and the goal changes to how do we provide patient comfort and family-centered care as the patient passes, rather than let's do everything we can to save them. Like when there are bad outcomes, like you have a plan in place kind of thing. Like you don't have to explicitly say that directly, but like they kind of want to know that you get that it can be that bad, and you're like here for it. You're not scared of that. Like that you do yoga or whatever.
Yeah. What can I say for one part of it? Like I keep work at work and home at home, like because I feel like I am good at like, oh, I'm home now, I'm not gonna think that's work, that's fine. Yeah, like I have a good support system. That's what I'm trying to say. I have a support system.
You have a good support system and people that you trust that you can talk to.
Yeah. Oh, you had a question on there. Sorry. Do nurses take sick days? And Well, my honest answer is yes, because if you're in the NICU, you're around kids who are very immunocompromised, and you can't be going in there sick. So I didn't know if that was like, if you're literally asking if we have to take, like, yes, because it's better to, maybe have someone fill in for you than you come and give a baby something or a coworker something, and then the whole unit has it. But yeah, so I was just gonna ask if that's the right answer, or if I should be like, you're never not a nurse. Like, I don't know. Like,
No, it's
like
exactly,
metaphor.
it's like, it's important to be dependable and reliable and show up to work on time, but the line gets drawn when, if you did come to work, like patient safety, like that's
Yeah,
where the line is. If it puts a patient, an immune compromised baby at risk for you to come to work, that's not okay.
Yeah, like I know it's for short staffed, but I'm sure they'd rather be short staffed than me come in and, give everybody COVID or get a baby really sick. So, okay, so I just saw that on the list, and I just wanted to make sure I was like on track with those, and I'm not like giving something where they're like, girl, what are you, like, leave? Like, what is this?
Yeah, they like sometimes shut whole units down if there's like a COVID outbreak because there's no one to run it anymore. Like,
yeah,
it's a thing.
That's scary.
Policy and procedure is, they're usually informed by, evidence-based practice, but also usually, if something bad happens to a patient, that informs change in the policy and procedure. So you want to really be respectful of that and know that the policies and procedures help you, especially as a new grad, keep your patients safe and make sure you give them the best chance at a good outcome. So you would never break policy or procedure. The only kind of scenario that you have encountered with this is, and then talk about a time that a family member wanted to visit and like why that didn't fit within your current COVID visitation policy, and like talk about kind of like the de-escalation thing that you do for like a angry family member, and then talk about how while the top priority is always keeping patients safe, we do want to also make sure we have an appropriate balance of like family and patient-centered care. So, after really listening to the concerns of the family member, I told them that I'm happy to advocate for them and to see what we can do. There's no harm in asking. And that I was going to escalate this to my supervisors and get back with the family member, to callback number, get back with them and see what we can do. And that I would let them know either way, and then say that you escalated to like your charge nurse and who escalated to the manager, and say like whether they were or were not able to get this visitor on the exceptions list or get an approval or whatever, and just say, sometimes we are able to accommodate requests. And that's sort of the only experience I have with breaking policy, but I would still do it as an exception through the appropriate channels. If the answer is no, then I would still prioritize patient safety, because these policies are in place.
They're there for a reason.
Yeah, exactly. Yeah.
Okay.
Yeah, it's a trick.
I could. Yeah. I mean, also I was like, I haven't really, not to be like a goody two shoes, but like I was like, I haven't really done anything that would. I'm a student, like I'm being watched. What would I have done? Sorry, my cat just jumped up.
Hi.
Peter, say hi. I know that you're late.
What's his name?
She loves Dallas. It's a she. Her name's Dallas.
I like
that was her pound name.
Thing.
Oh, thank you. I picked her out when I was little because we had the same little freckle. I have like a big, you probably can't see it, but I have like a really big freckle right here.
Aww.
And then she has like the same one on her nose.
Oh my God.
She was so cute when I saw her at the little pound, and I was like, we have the same freckle. I'm taking you home.
She's okay with being touched now.
It's because she jumped up. It was like her, it was her telling me, it was her giving permission. But if you come up to her, pet her, she's gonna like look at you, like herself, walk away, hide under the bed. But anyways, yeah, so okay. So the question is like a time you've had to break policy.
Yeah,
like,
they can ask something about that to trick you.
A time I used evidence-based practice.
Yeah. Was there something from your research class?
No, I wish.
We had one, didn't we?
I don't think so, because
we probably didn't, because it was just the HR thing.
It was just the HR. Evidence-based practice. Would that be, can I ask you like what they're trying to figure out from that? Because I'm sure I have a story, but I'm like, was I supposed to read a research article and then be like, I'm going to apply this here? Or
Yeah, so it's kind of hard. Like as a student, your only experience with this is like if you did a research class and you made a poster, or like somebody made you do a project where you like did a quality improvement thing. Um, Other things people talk about is like if they went with their preceptor to talk through like the bundle for how to prevent CODIs or CLABSIs or like falls or something. Like, did you guys ever talk about how to prevent
I
catheter?
wrote a I wrote a paper on class Bs or whatever. I wrote a paper about class Bs. And I know things about how to prevent them. I don't think like I've not inserted I haven't had anything to do with like inserting them. Like
No. Typically we don't.
yeah, I don't know if it's like I know like it's not ideal to have it in the inner thigh and that it should be taken out as soon as you can, and there should be certain procedures. Like I know the procedures for that. I read a lot of like research and stuff for mental health, and like read a lot of additional materials on like trauma informed nursing care, and I think it really taught me better tools for communication for people going through mental health crises and traumas, and it was something that I was able to use on the floor during my mental health rotation a little bit when communicating with these patients. So maybe I could I talk about that? Yeah.
Yeah.
I can
I mean,
expand on
I'm
that.
trying to think like these babies, it probably won't help you with the babies, but it'll help you with the parents.
Yeah.
A lot of these mothers have been through stuff,
Yeah, and it's like I can imagine. I mean, I can't really, but I can guess how, traumatic it is, especially if your baby doesn't make it. But yeah, I guess I'll answer the question. During my mental health rotation, I was able to read just a lot of research studies and a few books about trauma-informed care and nursing. And these research, this evidence-based practice gave me the tools on how to, on the signs and just how to assist someone who's going through mental health crises and having issues with their mental health. Just learning different ways of communication, really making sure that I have open body language, that I'm non-judgmental towards these patients, that I let them express themselves, really just allowed me to help kind of walk them through their really tough experiences in a non-judgmental way where they could express themselves. I think these tools have helped me in every situation since I've learned them. I did use them actively in the mental health rotation, but even in the ER, seeing kids come in with a really bad injury and the parents being really scared because this is the first major injury that their child has had, I was really able to, I think, help the family work through these scary issues and really care for their child in a physical way, but also in the whole family, for the whole family in a very psychological way. And I think they're tools that I use every day in nursing and outside of it as well.
This is amazing. Yeah, use that.
Thank you. Okay, I'm glad. I didn't know how to answer that one earlier too.
Yeah, that's perfect.
Glad we had that.
The time you had to adjust to a change at work, like you can always talk about COVID related change of like having to enforce masks and stuff.
Okay. Could I talk about visitors, because I've had a lot of like COVID visitor, especially because I started during the pandemic. Do you want me to answer it, or should I just give you an overview? Yeah, a time I had to adjust to a change was I started nursing school in 2020, so right at the beginning of the pandemic, and that was like obviously a huge change. And I think one of the biggest ones was floor, there was a limit to one patient or one visitor per patient, and that made things really hard because obviously their family member is sick, they're worried about that family member, and it's hard whenever only one, only the wife and not a child, or only one parent and not the other parent can come in and visit. And it was for their safety, and we weren't going to break that policy, and we talked about it with our charge nurse. But some families had a really hard time, and it was really hard to watch them adjust to that. I don't blame them at all. I don't think like it was an unusual thing. So I think just from just adjusting from maybe allowing those patients to have those freedoms and be able to, congregate and support their loved ones, and having to go through other methods like, FaceTiming or messaging or just finding other ways for the family members to connect while healing. It was a bit of an adjustment, but I'm thankful that we always found a way to keep loved ones together in some capacity, whether that be, through the phone or through FaceTime or, just one visitor at a time, taking turns. So we made it work.
I was just looking at the a time you had to be creative or innovative. You could totally, like you said, use the thing about like drawing on the Band-Aids and all that.
Yeah.
Yeah.
Getting creative with that little guy. Okay.
If we talk about strengths and weaknesses, that'll kind of hit on, why should we choose you? Like, what do you bring to our team? Like, why do you think you'd be a good fit here? Because that kind of doubles up with strengths and weaknesses. Do you have something you'd say for that?
For why they should hire me?
For
strengths and weaknesses.
That kind of talks about the strengths too. So I feel like if you talk about strengths and weaknesses as our last one, you'll be able to,
answer that one.
Yeah, because part of the game is sometimes I'll coach someone and I feel like we've covered all the bases, and I'll say, how did it go? And they're like, I don't know. They asked some really weird questions. And like, what did they ask? And they'll say, they asked this thing. And I'm like, that's literally just like a slightly different version of what we practice with. Like, you got to be a little flexible.
That's what I was learning through your videos, because I was freaked out because I'm not good at coming up with stories quickly, and when I'm stressed, you can see it. I can't articulate as well. I'm not as natural. But I was watching your videos, and I was like, oh yeah, that's just the same thing. Like, I could use the story in 4 different questions.
You literally just get like 10 of your favorite stories and you figure out how to squeeze them in. And if they ask you something where you're like, that's a stupid question, I don't know what to tell you, you can just say, that's a great question. There isn't a situation that's coming to mind at the moment, but I'm sure I will come up against that situation in the future. And what's going to be really important to me is making sure that I prioritize, and then say whatever it is that you think that they want to hear, right? Prioritizing patient safety and, really making sure that I communicate well, or like, if it's like a difficult patient question, like really making sure that I make sure my patients feel heard and they feel valued, and really taking the time to not only understand their concerns, but to really reassure them that I am going to address them immediately, and whatever. Like, you just say what it is that you think is on their rubric. Because the way it works is you have the question, and then you're supposed to score them like 1 through 5 or whatever, and put little notes of like what they demonstrated or what, your concerns were. And it'll say in parentheses, like, ability to demonstrate such and such skill, like whether it's de-escalation or, able to take ownership of mistakes and make changes going forward or whatever. So you kind of guess what's on their rubric, and you tell them that that thing is something that's important to you when you have those situations. Yeah.
Okay. That's good to know. That's
work backwards.
No, that's so smart. Wow. Thank you. No, I'm just always so amazed. Sorry. First, do you want me to tell you my strengths?
Strengths and weaknesses. Let's do this one. And then the rest, let me know how this one goes. And then also, you should do a thank you note unless they tell you not to. And it's
hard. Do they tell you not to?
Huh?
Do they ever they tell you not to sometimes?
Sometimes they'll say, please don't. But you'll want to thank them. And it's the best way to do it is anything that they've told you, you thank them for sharing that with you, and you tell them how great it was to hear that. Maybe pick like 3 things and put one in each paragraph. And like, always start by like, thank you so much for taking the time to meet with me regarding this position. It was so great getting to know you and more about the hospital, whatever. Thanks so much for sharing about this thing. I'd love to work in such a supportive environment, yada, yada. It's also really great to hear about this thing that you work on. I think that's so important. I really value that thing as well. And I'd love to start my nursing career in a facility that is really prioritizing that. Like in the last paragraph, like, thanks so much for giving me the opportunity to get to know you and learn more about the hospital. And please reach out if there's any more information I can provide, or if you have any questions or whatever. Like, that's just kind of your like thing. And you just plug in like literally anything they tell you, that's what you plug into that.
Okay,
Yeah.
that's
But
nice.
anyways,
Thank you.
strengths and weaknesses. Let me know how it went. Send me your draft. I can like look at it and let you know if there's anything you want to add or change or whatever.
Okay. Yeah, that's perfect. Yay. Okay, for
So
strengths and
what would you
weaknesses,
say are your strengths and weaknesses?
I would say that my strengths, I'd say I'm a team player and I've learned the skill from various sports, from working in environments where I have to collaborate with one another, just in school. I think that working as a team, you're going to get so much better, so much more done, and you're going to be able to just give a high level of patient care. I think more heads are better than less than one, and just having everybody's knowledge, input, and just learned experience will help you grow and become a better nurse. Another strength I would say that I have is I'm very open to criticism, constructive criticism. I always want to be a better nurse. I want to provide the highest level of a high standard of care to my patient, and I always value patient safety. If there's another nurse who knows more, who's willing to impart some of her wisdom on me or to help me become a more efficient, safer, or better nurse, I want to become that. And I'm so open to any suggestions that any of the nurses would have for me. Another strength I would say I have is that I'm a very hard worker with a good work ethic. I'm task oriented. I really, really like getting things done, making sure that my patients are cared for, that they feel cared for, that that they don't go without anything, that whenever I leave the shift, that they felt that they've had someone who's really walked alongside them and cared for them the entire time. And I'd say that another strength I have is communication. I feel that I'm good at communicating with other team members, whether that be respiratory therapists, CNAs, other nurses, or doctors on the floor. I think open communication is such a vital role in nursing, and it's going to be what makes or breaks your nursing practice. And then
Real quick before we go to weaknesses,
yeah,
don't forget this. So sometimes new grads are in a negative way described as task oriented, meaning like they go in the room.
They only want to do the task. They don't want to like care for the patient,
right,
or like do extra stuff.
Right. They're like task oriented in the sense of like they know they need to pass the meds and they need to, so maybe let's say, I need to give this core egg, but I need to take the vitals, but they don't connect like, oh, well, the systolic was 85, so maybe don't give the core egg right now. Like they're just so oriented that they just like can't notice anything else, right?
Yeah, that makes sense.
Or like they're desatting, like I need to call a rapid, and then rapid comes in and they're like, hey, the oxygen isn't plugged into the wall. Like it's just
tunnel vision.
Tunnel vision, that's what it is. So self-describing as task oriented, I think if they've heard someone described as that negatively before, they're like, I don't love that. So other words you could say you found you really enjoy working in a fast-paced environment, or you
that's a way better way to putting it.
Yeah, and I think kind of what you were talking about too was like being detail oriented. There was something you said about making sure that your patients aren't left needing anything. It kind of ties it back to the thing about like, making sure the little details, like that their hair is taken care of, and because you like working in a fast-paced environment, if you've learned that when you're able to manage your time well, it leaves time for all the little details that you enjoy doing to, really take good care of this patient as a person,
that makes sense. Yeah.
Frame it as that more. Just the words task oriented is kind of, it has like a connotation that they might have like a different idea about, you know what I mean?
Yeah, kind of in relation to your story about like nurses just wanting to get stuff done. I kind of, as I was saying it, I was like, I don't know if this is like the best word to describe, but I like to make sure that all the meds are given, but I care about other things, but I get what you mean. Yeah.
So what about weakness?
Weakness, well, my biggest weakness I would say is as a new grad, I have lack of experience. Obviously, I have experience on the floor under another nurse, but being a new grad, I haven't had a job yet, and I just really need those experiences as a nurse. But one thing is that I feel that I'm really open to learning now, and that I'm really just ready to be the best nurse possible and learn as much as I can. And another weakness I have is that I am a little too detail oriented sometimes, and I feel that from time to time slows me down. But I'd rather just be super careful and make sure that everything is right and perfect for my patients rather than rushing through something and being sloppy.
So for the weakness, just pick one. I would stick with the
Okay.
first one.
Okay.
And then the game for the weakness is basically you talk about it like it was something you used to really struggle with, and then someone gave you this amazing piece of advice, and now it's really helped you because you're able to do this thing now. So like, what was it you were talking about? Oh, that you lack experience. You could say that you had a clinical instructor that really encouraged you to seek out the most intimidating skill at the time. So there was a time that I hadn't done IVs yet, and I was really nervous to put an actual needle in someone, because it, might be painful. But she said, when you feel that, to kind of see it as an opportunity for growth. So I signed up for a time in the skills lab to practice first with the mannequin to make sure, because I am detail oriented and I want to take good care of my patients. I really want to make sure that I understand like the procedure and the policy and everything before I would never just wing it on a patient. But once I felt comfortable with the skill, knowing that I'm doing it in a way that's evidence-based, I would let my nurses know if there's any IVs that are needed today. Is it okay if I try, because I need more experience with this, and I'd love to learn from you the tips and tricks that you use that help you be successful with this. And so they knew that anytime someone needed an IV, they'd ask me. And it basically it really just taught me that, because I started to get better at IVs, and the better I got at them, the more confident I became in them. And then I was able to get even better at them after that. And so it I shouldn't say basically, it taught me that anytime, there's a new skill that seems intimidating, I'm going to talk to my preceptors about it and see how I can, in a safe way, get as much experience as I can with that thing to kind of slowly broaden my comfort zone. Because I don't have experience working on my own as a nurse yet, but I think it will help me to grow as a nurse if I don't avoid those situations that I'm not comfortable with yet, to really be open to learning and to see them as opportunities to grow and to learn. And it's been fun bonding with my preceptor or the nurses when they know I'm excited to learn about something and they're able to share all of their hard-earned knowledge. It's just been a really much more supportive learning environment than just shying away from the things that are intimidating. I feel like that's a really long-winded answer, but something kind of
No, that was good. Yeah, no, I have a similar thing with I really don't want to do IM injections for the longest time. I don't know why, it just scared me. I wouldn't say that, but like I was so scared of them for
you
some
could totally
reason.
say that.
Yeah, I did that, and then I signed up for a flu clinic, and by the end of the flu clinic, I loved it. Was so fun. Like I felt like I was really good at them. So yeah.
Totally talk about that.
Okay, I'll talk about that. Okay.
Because that's the thing is,
Yeah.
I was like, I wish she had said, because there's people who have said like, I want to work in P, or what was it? I really wanted to work in OB. I didn't get a preceptorship in OB, so I found volunteer opportunities in OB. I became a doula.
Oh, awesome.
Like she sought out these opportunities. So you could say like I was really uncomfortable doing IM injections, so I knew the only way through that was to learn procedure of how to do it and practice in the skills lab. on a mannequin, but I really needed to get experience with patients. And so I signed up for the flu clinic, and yeah, just basically because what you were saying, it, you were like genuinely animated in your face, which I think is not only like helps them bond with you, but it's kind of like more entertaining because they have weeks where they have to listen to everyone just give the same old bland, like flat answers. Like the person who can actually make them feel like they're talking to a real human is like such a breath of fresh air, you know?
Yeah, definitely.
Doing
No, I
these
definitely
back
get
to
that. I
back
could just get over my yeah. Oh yeah, no, I looked at their sign up list and I counted because I'm crazy. And they had like 200 spots like filled, and I was like, oh my gosh, yeah, Survey Monkey, you can just see. So I just was like counting, and I was like, okay, we're in the hundreds, 150s, 200s. So
Wow.
yeah, definitely we'll need to have some energy.
Yeah. Yeah.
Yeah.
Did we talk about questions that you ask them?
Yeah, we
Okay.
did. And I used your and I think it went over really well. Like I said, I used the what characteristic makes new grads successful.
Yeah.
And they both were basically like being open and being wanting to learn. They don't want me to be like, I know how to do it. And then yeah, which I feel like I'm good with criticism, and I'm if you want to show me how to do something, I'm so happy for that. Like I love that. So
Yeah.
that was good. Do you think I could not, it sounds bad, I don't mean reuse them in a lazy way, but I genuinely like those questions, and I definitely like to know, like, you think I could reuse them, or are they gonna like
Yeah,
no
it's
and be like
different
that's
people for sure.
yeah, definitely. I don't, neither of them were NICU, I'm pretty sure. One of them was like, yeah. So I think I'm just gonna use the same questions because I genuinely like to know the answer. But yeah, okay.
Yeah, just make sure you get good sleep, you have like whatever food situation makes you feel good, and you're just like ready to have a good day there.
Yeah. Thank you. Yeah, that's all I've hoped to do.
And also just knowing, like, I've seen the people who are like, oh my God, this is my dream job, I need this job. It never works out. But the people who are like,
It's me.
don't bring that frantic energy.
Oh, I won't.
Like, you got to just be like, I'm just gonna ask that I'll be placed in the job that will allow me to do the most good, and I'm gonna trust that that's gonna happen, and just be grateful in advance. Like,
yeah, that's definitely, I mean, it is the job I really want, but at the same time, I'm not gonna, there's things where I'm like, this would be perfect, and then it doesn't work out. I'm like, oh, thank God it didn't work out. So I'm not gonna like, I'll be sad, but I'm not gonna like burn
you're
my
gonna
house
be
down
an
over.
amazing nurse. You're gonna help lots of babies and make lots of parents feel like supported and safe wherever you work. So, that'll be fun.
I appreciate you saying that. I really appreciate you saying that. That means a lot.
Yeah.
Thank you. And I'm sorry, I know we're probably like out of time.
Oh yeah, I should probably go. But I'll send you this recording so you have it too. Yeah, make sure you go in like really centered and
yeah. I think we'll be good. Okay. Well, yeah.
So I'll be thinking about you on the 1st. I'll send you this recording. If any other questions come up, let me know. I'll be around.
Okay. Perfect. Thank you for everything. I really appreciate it.
Yeah, it was good to see you again.
Good to see you. I'll keep you updated. Thank you.
Okay. Bye.
Bye.